If cold air really caused colds, penguins would need pediatricians on speed dial. And if teething explained every fever, the tooth fairy would need a medical license. Mama, here's the hidden truth. The advice we've all been handed down, bundle heavier, rub menthol, blame teething, doesn't always keep your baby safe. In fact, some of it backfires. In this video, we're busting 5 winter illness myths almost every parent still believes, and giving you the real, science-backed secrets to keep your baby cozy, happy, and healthy all winter long. Myth number 1. Cold air gives babies colds. Keep them inside and bundle heavy. Raise your hand if your mom, your aunt, or your neighbor has ever gasped. Don't take the baby out, they'll catch a cold. Meanwhile, your little one is climbing the couch like Spider Baby because they've been stuck indoors all week. Truth bomb, cold air doesn't give colds. If it did, penguins would need a pediatrician on speed dial. What's actually true, colds, flu, and RSV come from viruses, not the weather. Winter feels like germ season because we huddle indoors, share air, and the dry air helps viruses float and last longer. So it's the environment, not the temperature, that spreads colds. Fresh air, totally healthy. What to do? Dress smart. Skip the marshmallow look. Think layers. Thin, cozy ones you can peel off. Add a hat, mittens, and socks. Rule of thumb, 1 extra layer than you're wearing. Stay dry. Wet socks equals cranky baby. Change them quick. No limits. Short winter walks are golden unless it's freezing wind or your baby's lips look purple. Inside fix, run a cool mist humidifier, clean it often, to keep air moist and kinder on baby noses. Cold air doesn't cause colds. Viruses do. Layers plus common sense equals happy baby plus a saner mama. Myth number 2. A high fever always means danger. Bring it down to normal fast. Your thermometer flashes 101 degrees Fahrenheit and your heart sinks. Cue the panic. Is my baby in danger? Should I rush for medicine? Take a breath, mama. Fever isn't the villain. It's actually your baby's body tool to fight germs. What's true? Doctors define fever as 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher, rectal in infants. Fever helps the immune system work better, so you don't need to chase normal numbers. What matters is age, symptoms, and how your baby looks. 0 to 3 months. Any fever 100.4 degrees Fahrenheit or more. Call your pediatrician immediately. 3 to 6 months. Call for 101 degrees Fahrenheit plus, or if baby looks really unwell. Any age. Worry if there's trouble breathing, dehydration, no wet diapers, no tears, nonstop crying, seizures, or if your gut says something's off. What to do? Focus on comfort, fluids, breastfeed or formula as usual. Don't overdress and let baby rest. Medicine? Only if baby is really uncomfortable, and always by age-weight guidance from your doctor. No aspirin. Myth number 3. Antibiotics will help my baby's cold. Ask the doctor for them. If antibiotics worked on colds, winter parenting would be a breeze. Sadly, that's not how it works. Antibiotics fight bacteria, not viruses, so they won't cure colds, flu, or RSV. What's true? Most winter sicknesses in babies, like runny noses, coughs, or flu, are viral. Giving antibiotics just in case won't shorten symptoms and can actually do harm. Rashes, diarrhea, and antibiotic resistance down the road. Doctors only prescribe antibiotics when there's proof of a bacterial infection, like strep throat, bacterial pneumonia, or certain ear infections. If your baby has the flu, antivirals, not antibiotics, may help, but only if started quickly. What to do? Ask the golden question. Is this viral or bacterial? That decides the plan. If it's flu, ask your doctor right away about antivirals. Comfort care is your best friend. Saline drops plus gentle suction for stuffy noses, cool mist humidifier, extra fluids, cuddles, and rest. Right drug for the right bug. Myth number 4. Steam rooms and menthol rubs are the best fixes for baby congestion. Raise your hand if grandma swears by steaming up the bathroom or slathering Vicks on baby's chest. Sounds cozy, right? But here's the catch. Hot steam and menthol rubs can actually be risky for little ones. What's true? Pediatricians say skip the steamy bathroom trick for babies and toddlers. Steam feels soothing for us, but with tiny airways and sensitive skin, the burn risk is real. Same with menthol or camphor chest rubs. Those aren't safe under age 2. Camphor can irritate breathing and is toxic if swallowed or absorbed through skin. Yikes. What to do instead? Use a cool mist humidifier across the room, not right next to baby. Clean it daily to avoid mold and mineral dust. Try saline drops and gentle suction before feeds and bedtime to clear that stuffy nose. Hold baby upright for cuddles or safe naps to ease breathing. Skip the chest rubs until age 2+, and even then, follow directions carefully and keep the jar far from curious little fingers. Bottom line, for baby congestion, think cool mist, saline, and thyme, not steam and menthol. Myth number 5. Winter fevers are just teething. Don't worry. How many times have you heard it? Baby's burning up and someone says, "Relax, it's just the teeth." Sure, teething can make babies cranky, drooly, and keep everyone up at night. But it doesn't cause true fevers. What's true? Teething may bump the temperature a tiny bit, but not into fever range. A real fever is 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. And teething never causes diarrhea, cough, or serious illness. If your baby has a true fever or looks unwell, assume infection first, like an ear infection, UTI, RSV, or flu, not teeth. Waiting it out with "it's just teething" can delay important care. What to do? For teething, offer a clean teether, gentle gum massage, or a chilled, not frozen teething ring. For fever, follow the age rules. Call your doctor right away if your baby is under 3 months with any fever, or older with high temps, breathing issues, poor feeding, or fewer wet diapers. Trust your gut. If your baby just doesn't seem right, reach out.